A prescription formulary exception? What is that? Why should you get one? And how to get one? Let's explore. Welcome, I am the medical bill whisperer, a previous billing manager turned patient advocate. I am committed to bringing answers, insights, and solutions to patients like you. But let's start with the beginning. What is this formulary? It is the list of drugs, either oral, infused, or injected, which your insurance plan covers, meaning agrees to pay for. That list is very specific, and requirements must be met for coverage. Being on the list does not automatically guarantee the insurance will pay for it. For example, the prescribed treatment must be appropriate for the diagnosis and follow the manufacturer's guidelines. That means the dosage, frequency, way of administration, etc. That is also called on-label. But the drug or treatment must also be medically necessary, meaning it is required to cure, maintain, minimize, or positively affect a condition or a diagnosis. An example would be an antihistamine used to counteract an allergic reaction or chemo to cure a cancer. Your doctor's medical records must clearly indicate how they got to the rationale of ordering this prescription for you. Document how it is the best, only, or last option. The prescribed treatment must also be FDA approved, meaning the FDA has deemed it to be safe and effective to treat your specific diagnosis. The terms of your insurance medical policy must also be followed. Your insurance can impose that other, more conventional, less costly courses of treatment must have been used and failed, or that only specific diagnoses are covered, or that certain tests or scans must prove that the condition indeed exists and at what level of severity. The prescribed drug must also be obtained either through an in-network local brick-and-mortar pharmacy or through your insurance preferred mail-in order company, such as Amazon Rx, Optum Rx, Costco Rx, CVS Caremark, etc. But even if your prescribed treatment or prescription is on the formulary, does not mean that coverage is automatically approved. Some drugs do require pre-authorization or pre-review, but if one or more of the other requirements are not met, your insurance can indeed deny coverage of a formulary drug. For example, the diagnosis or condition do not meet the criteria for coverage, or the medical records are insufficient, missing, do not explain the need for the prescription. If the treatment is off-label, meaning not FDA approved as prescribed, either the drug does not follow the manufacturer's guideline for use, or it has not been proven safe and effective for your condition. And if the pharmacy or mail-in company you choose to fill that order is not in-network or not preferred, your plan has the right to reject any request for coverage or payment. But oftentimes, another main reason for a denial is just because the prescribed drug is not in the formulary at all. It could be too new. The FDA approves about 40 to 50 novel drugs every year, and it could take time to be included in a formulary. Or your prescribed drug could be brand name, and the formulary offer at least one generic option for it. Your plan is only obligated to provide one option when more might be available, Not every version of every kind of drug out there must be listed in the formulary. Limiting it to generic options when those are available saves your insurance and members money. But a big issue with drugs not being on the formulary is because of special deals. Insurance companies hire or own what are called PBMs, Pharmacy Benefit Managers. These are companies that manage the prescription drug benefits for insurance plans, employers, and other payers. They pay claims, handle authorization requests, and yes, keep the formulary updated. They can negotiate pricing with drug manufacturers and pharmacies to lower costs, obtain rebates, and ensure that others have access to medications. But a big problem is that, in effect, asset managers, not doctors, decide what drug is included in the formulary, when it is payable, and for which patient, usually based on cost rather than clinical criteria. This leads to preferential drugs being on the formulary, forcing patients to switch between brands at the whim of these PBMs. But if your prescription or treatment has been denied, or if the drug is not on the formulary, all is not lost. You can get a formulary exception. By you, I mean the prescribing physician. Every plan has a special process and form for the prescribing physician to request that exception and coverage of a non-listed or denied drug. Upon submission of a form and clinical and other documentation to justify the request, the medical director, pharmacist, or specialized nurse can issue an exception to cover a specific treatment or drug. And if the answer remains no, the physician can file an appeal, which is a separate request for a review of the decision based on medical records, standard of care evidence, professional articles, medical policies, and any other supportive justification. One reason to always request a formulary exception is when there is a shortage. This is a valid reason easily granted. Either your doctor or your pharmacist can file for it. And your pharmacist can also request a one-time exception if a pharmacy is temporarily out of stock. If you have a secondary condition that impacts the request, it is time to include it with the form. For example, if another prescribed treatment causes a side effect, which does not technically meet the requirements for coverage based on a diagnosis, the prescribing physician can argue that by extension, the treatment should be covered. As for drug interaction, allergic reactions to the formulary options, tried and failed treatments, these are all valid and accepted reasons to request exceptions. A formulary is very fluid. What is offered is based both on customer needs and on profits. Insurance call that cost saving. But it can change from month to month based on availability, number of prescriptions, manufacturers' rebates, FDA mandates, and other criteria. Patients are impacted when the formulary changes, imposes unacceptable choices, limits access, or makes arbitrary cost-saving decisions. But the good news is you have rights, and one of them is to obtain a formulary exception based on your clinical needs and medically based evidence. The proper medical records and documentation, success should be at the end of the tunnel. I thank you for watching. Your comments, likes, and subscribes are most welcome and help this channel grow a little bit at a time. So thank you.